Our next speaker is Roberto Pazo. Roberto Pazo is a medical doctor specialized in oncology at the University Hospital Miguel Servet in Zaragoza and clinical researcher of the Aragonese Institute of Health Sciences, EX. He has more than 10 years experience on research and treatment of upper gastrointestinal tract tumors, experience and research activity that he is presenting to us today. Roberto.
Okay, thank you to the organizers for inviting me to this meeting. I'm going to summarize some of the clinical and research activity that we take in our unit. This is our facility, where the hospital, Miguel Servet University Hospital, and up there in the slide you can see some of the people working with us in our department. As you can see, most of them are women. So there are 10 subunits treating solid tumors integrated in our department. We are referred every year more than 2,000 new diagnosed cancer patients. My field of expertise is particularly hepatobiliary cancers, upper gastrointestinal cancers. Most of us in every subunit are medical oncologists and dedicated to both clinical and research duties. Clinical trials are our main research field, and around 10% of these new diagnosed cancer patients every year are recruited in clinical trials. This means around 200 new diagnosed cancer patients per year are recruited into clinical trials. Most of them are recruited into phase 3 clinical trials, around 50%. 35% are recruited into phase 2 trials. Less than 10, 20, 15% are recruited into phase 1 trials. Most of these trials, testing new drugs, are addressed to metastatic disease. More than 50% of the patients, 60% of the patients, with some new drugs also addressed to the neoadjuvant and perioperative settings. Most of these new drugs are dedicated to modify the microenvironment of the tumor. Particularly in the last 6-7 years, most of these drugs have exploded the immunotherapy trials, have exploded the immunotherapy drugs, and around 50-60% of the clinical trials that we are currently recruiting on are immunotherapy trials with new drugs. Moving forward on my field of expertise, I would like to remember this, that we were invited to write this editorial comment on the Chinese Clinical Oncology first issue. It was a pleasure and also a honor to write this editorial. In the field of upper gastrointestinal cancer, our efforts are mainly centered in pancreatic cancer. Some of the speakers that have spoken before me have talked about this particular cancer, particularly drug-resistant and particularly impenetrable tumor to drugs. More than 50% of the recruited patients are recruited into these trials testing new drugs for pancreatic cancer. But we also are interested in gastroesophageal cancer, biliary tract cancer, particularly intrahepatic cholangiocarcinoma, and also hepatocellular carcinoma. Most of these new drugs are tested in metastatic disease, and some of them in resectable and locally advanced disease. Clinical facilities are near from translational research labs, and this makes that integrating of clinical investigation and translational research can be combined. We are focused on quality of care and the standardization of clinical samples collection, handling, processing, and staging of these clinical samples. This is an example of a patient clinical and investigational sample workflow. As you can see, standard clinical samples and clinical translational samples can be collected and stored in parallel. And this case is, for example, the case of a gastric cancer patient with treated perioperatively with chemotherapy combined with an immunotherapy a checkpoint inhibitor. So in conclusion, we have a great potential for recruiting patients for clinical trials, and in the next 2-3 years, our goal is to duplicate this recruitment rate, and we're interested also in integrating translational research with nanoscientifics and immunologists. And that's all. Thank you very much for your attention.